we received confirmation with regard to funding for our new hospital in Harlow. So as you know, we're part of the new hospital programme. We know that the delays to the new hospital programme over successive governments and over many years causes great frustration to local people, also causes great frustration to our staff. What I would say is that there's probably greater certainty now than ever before that at some point Harlow will get a new hospital that directly responds to local need. What I would also say though is that the shape of that hospital is probably quite different now from what it was when we first developed the scheme several years ago. So if you think about what I was saying about neighbourhood health and doing more in the community, it's as much about redeveloping what we currently have in terms of our district general hospital as it is about the development of neighbourhood health hubs in places like Heart and Essex Hospital, in St Margaret's Hospital, in London Memorial Hospital perhaps to the east of us. That's what the new agenda is about, and we're absolutely wanting to be at the cutting edge of it as we progress our capital redevelopment plans. Throughout all the changes, we've had other bits of instability. So periods of industrial action have had a significant impact on our ability to provide services and therefore had an impact on our patients and the community. It's always a difficult one, this, because obviously the parameters of the disputes are outside of our control and influence, but what we do try and do is support our staff to provide the best possible services during periods of industrial action. Something that I think is very much within our control is what our staff say about us, the staff survey. So every year, our staff are asked to fill out a survey to talk about the experience of working at PAH. Around at the same time, our patients get the chance to fill out a survey. It's not on the slide. We have a national inpatient survey. It also takes place usually around September, October, November time. On both of them, we can do so much better. If you think about the NHS performance, quite often people talk about financial performance, they talk about operational performance, government targets, and all those things are really important. But actually, if staff are telling us that PAH is not a good place to work, if patients are telling us that PAH isn't always a good place to receive care, that worries me more than anything else, and that's the bit that we need to try and correct. So whether it's from a staff perspective, whether it's from a patient viewpoint, we need to be listening and being prepared to change our services further so that we start to meet the needs and expectations of the public and also our staff. And of course, when it comes to staff, part of it is recognising when people do some fantastic stuff. So one of the things we've done recently is launched our Time To campaign, which directly recognises staff achievements. And on staff achievements, I've got a few individuals to call out as part of this as well. So first of all, congratulations to all our amazing people. People work so hard at Princess Alexandra Hospital. I find it awe-inspiring when I go around our clinical areas and see the amazing work that people do. It's my role, and it's our role as a board, to ensure those fantastic people are empowered to do even more. There goes another one. And not blocked by bureaucracy or nonsense, actually. We need to put the power in the hands of the clinicians to do what they know is right, based upon their practice and based upon their expertise. So, I said I'm going to talk about individual successes. So first of all, our fantastic Director of Medical Education, Dr. Preeti Gopinath. Preeti is our Director of Medical Education, and she actually won the National Director of Medical Education of the Year Awards. Now this has been an area of real risk and concern for PAH over the years, and the turnaround that Preeti has overseen has been truly phenomenal. I don't think Preeti's here, is she? Just checking the room. She's not. But well done, Preeti. Just an incredible achievement. On a month-to-month basis, we recognise excellence in nursing care through our monthly Daisy Awards. We've had too many winners to list here, but well done to each and every one of them. The gentleman that is here is Kelvin Langford at the back of the room, right over there in the corner. Kevin is a head of security and car parking. Quite rightly, Kevin was awarded the British Empire Medal earlier this year. Another person who was awarded the British Empire Medal is a fantastic chair of the patient panel, Anne Nutt, who I saw there's Anne. Yeah, exactly, right. 3 rows back. I've worked at a number of hospital trusts in my career. I've never worked at a hospital trust that has such a proactive, such an engaged, and such an influential patient panel. They're an absolute asset to us as an organisation, and anything we can do to grow membership and to make them even more connected to the life and soul of the hospital, we're up for. So thank you so much, Anne, and to all your colleagues. And of course, all the amazing people, and all the amazing staff that won Amazing People and Long Service Awards at the event we held last. The league tables, government league tables, not universally popular in the NHS world. It's quite a blunt tool in terms of assessing trusts, including acute trusts like ours. So the new oversight framework came in only a few months ago, and the fact remains that if that framework had been applied to PAH last year, or the year before, or the year before that, in fact any time since COVID, we would have been at the same level, if not lower now, because things have slightly got better against the metrics, but the framework is new. Is that an excuse? No, it's not. I'm really concerned about how low down we are in the league table. There are various factors for it. So the sort of thing the league table considers are the patient survey, what patients tell us, the staff survey. It considers our financial performance and whether we receive deficit funding, which Tom covered earlier on. It covers whether we're hitting our operational standards and other quality metrics too. And I think we should strive to do far, far more. And in fact, if I'm being really self-critical, I think that when I first came to the organisation, there was a sense of, well, this is just how things are around here. This isn't how things need to be around here. We could be so much better for our patients. So let me tell you about some of the changes that we're making. So first of all, we've already made, and are making further significant senior management and leadership changes to get a fresh approach to some of the way that we tackle the patient care that we need to deliver. Secondly, we've just had a massive restructuring exercise of our divisions. We've completely changed the way that we are operating internally. A few reasons for that. One, to ensure a greater degree of clinical leadership as opposed to managerial leadership. Two, to remove some of the tiers of bureaucracy that we have in the organisation. Three, to ensure that our new operating model also factors in neighbourhood health and community care, as I was talking about earlier on as well. And actually to have fewer divisions overall so that our staff are more bound together. We've got too many silos already in our organisation. That doesn't lead to positive care or experiences for our staff. We're investing hugely post-consultation with regard to organisational development and support for staff. We want to develop a sense of belonging for our members of staff. It's not right for me that people just happen to work at PAH and I work at PAH. It should mean something to work for PAH. There should be an emotional connection there to make sure that you care. And so we need to change some of our working culture around that. And there's a big cultural development program to try and support that. In particular areas where we're struggling, so for example, cancer care, we've had external reviews, so 2 external reviews, one from NHS England, our regulator, one from a neighbouring trust who are excelling in cancer care. It was clear from the outcomes of both of those reviews that we need to completely change the way that cancer care is structured at the hospital, change the referrals we make to what we call tertiary or specialist partners, and also change some of our individual cancer pathways. Of course, some of the pressures that we experience when it comes to the operational targets are caused by the fact that there is a lack of community infrastructure, a lack of integration, and a lack of engagement with primary care, mental health services, community services. That is part of the reason why we spent so much of this AGM talking about some of the changes that we're looking to make in that space. Again, we're at the beginning of that journey, but I assure you we've absolutely started it. And any member of staff in the organisation now, I think, will be able to articulate how things have shifted over the last few months. So it isn't good. We are where we are in the league table. That would have been the case had the new framework been applied over the last few years. And I'm really clear and confident that we need to make some radical changes to shift our fortune. But I was appointed on a big change agenda, and that's what I'm going to deliver.